So that alone tells you that NHIF and SHA, you can't compare the two. Honorable Speaker, the package, the benefit package.
Yes, Angela, what is it?
I never asked how many wives does SHA cover. My question was...
Order, Angela. It is public notoriety that you have been proclaiming how many wives you have.
But I didn't say how many they should cover. He should answer my question. He should go back and answer my question.
Okay.
That nobody chooses which type of disease, the type of, whether expensive disease or cheap disease. So what we are saying is that SHA should cover everything once somebody is sick. Because it guarantees that.
Honorable Speaker, I have been with him for many years in this house. You can see, even when he's asking, he's a very happy man. So he's very happy with my answer that this is a better package. But Honorable Speaker, the benefit package is gazetted and is available. The package was passed by this house. How much is for oncology? How much is for dialysis? How much is for... And if the house, through its wisdom, increases the package, we will. But the package was passed by this house. The package under law is due for review by the Health Benefit and Advisory Panel. And I've taken the concerns of Parliament, and Parliament should also provide the budget. But Honorable Speaker, let me even go a different way. Because many members were asking the differences between NHIF and SHA. For surgical tariffs, across all providers, any surgery, they are unstandardized across all the providers. Before you could go to a private hospital, they charge you a different amount that is charged in the faith-based, that is paid for in the private. But now we have said any surgical procedure, whether it's you go to Aga Khan, or you go to a county hospital, or you go to a faith-based hospital, it is standard. 2, the tariff limits have been increased by 12% under SHA. And I want members to look at even the law we have passed. Every tariff, every benefit tariff have been increased by 12%. Under NHIF, the limits were different for different facilities. Different hospitals were charging differently. And Honorable Mama Degorot, Beatrice, let me agree with you. Healthcare is very expensive. And it depends on which hospital you choose. So you must be very careful which hospital you take your patient to. There are hospitals, private hospitals in our country, that if you stay for 5 days, you get a bill of 11 million, when it should be 2 million. I have concerns. So I think in previous parliament, we have discussed the cost of healthcare in our country. Before this house, Honorable Speaker, my committee, led by Honorable Dr. Nyikal, is looking at quality care and patient safety bill. I think we must do amendments to that law to deal with the cost of healthcare in our country. In other professions, lawyers, their costs are regulated. We must regulate as a country. I'm sure those who are doctors who are in this house and the ones who work with me will not be very happy, but we have to say it. The difference between NHIF and SHA, emergency evacuation will soon be launched. There is the ECCIF. Once we do the emergency evacuation, the ambulance will be paid for by SHA. The first 24 hours will be paid by SHA. That never used to happen under NHIF. All Kenyans now will have an access to an ambulance. The days when a patient is taken to a hospital or an emergency and you are asked for deposit is over with Social Health Authority. These are the benefits. SHA will pay for the ambulance. SHA will pay for the first 24 hours. The only package that I think the feedback we got, and we get a lot of feedback, we have a call center, 147, that every day over 5,000 to 10,000 Kenyans call. We get feedback from leaders like you. We get feedback from citizens on their concerns. But the Social Health Authority, the Social Health Insurance Act, the Primary Health Act. Let me tell you the biggest difference between NHIF and SHA. And this is now where I should want to thank this House and the leadership of this country. Primary health care paid by the Exchequer at level 2, level 3, and sub-county hospital is free. You walk in, you walk out. Now let me come to the question of my sister, Samburu West. Yes, if you ask me, if you put a question on those who are co-charging, I will provide. But I think complimenting the ones who are doing good work, I think I'll do it. You know, it's members who oversight. Mine is implementation. But I agree with you. It is criminal, it is unethical, it is immoral for when this House has appropriated resources for Kenyans who access outpatient through the primary health care fund. And the money is supposed to utility as capitation. You're asking Kenyans to buy exercise book, to pay for laboratory. Mr. Speaker, that is immoral, it's unconstitutional, criminal even in the law that you have passed. And I think a time will come when we shall shame those facilities and in those counties, whether even my referral hospital, if they charge extra than what is provided. On St. Mary's, Honorable Speaker, even if I was a resident of Kakamega, maybe my children also could have been born there. But let me make it very clear, Honorable Speaker, I've even given you the data as one of our leaders. St. Mary to date, SHA has paid 114,548,896. The claims which are with us, which we will pay in November, which is this month, is only 5.5 million. I went to Kakamega myself. I sat with the whole team, our Lord Bishop. We sat with the whole team, the bankers, the SHA team. We reconciled. We did a press conference. But that is a faith-based facility. I cannot go and open it. Now that I have given you the amount of money, the one for NHIF is a legacy debt, just like Consolata Madari Hospital. Honorable Speaker, St. Mary has become a political hospital. I cannot go and open. I am ready to go with you, but I told the Lord Bishop, when you're opening, call me. I'll even bring extra drugs from the Ministry of Health. We're waiting for the day to be opened. So let me send my good brother, please, 114 million have been paid by SHA. 5.5 we will pay. The reason why it's not being opened is beyond my control. It's the way if Nairobi Hospital today closes and I have paid them the money and maybe they want to go and open a hotel, there's very little I can do. Honorable Speaker, so St. Mary, that is the case, but we are, as a Minister of Health, we are working, and I really want to ask both Professor Undo and my brother Kibagendi that I need to get the details of those two patients and see those particular hospitals. We have hospitals that also want to co-charge people. They don't want to use the right tariff. It's called decoding. But I'll ask Mercy and myself, Honorable Kibagendi and the professor, just share with me so that we check from the system, and if we feel there is a problem, we will go resolve it. It's part of the feedback we want. But we are working on to reduce the cost of healthcare. Number one, by introducing reforms in the KEMSA, making sure we do bulk procurement to reduce the price of drugs. We want to do contract manufacturing. We want to do strategic purchasing by SHA. And that's why we also introduced the next program where hospitals don't need to pay for equipment, neither the county or the national government. vendors bring their equipment, they put it there. The number of Kenyans who use that, then SHA will reimburse those vendors based on the number of patients that go through. Honorable Speaker, on Mheshimiwa Jalango, in the journey of UHC, countries must make a choice. And I think he has left. Yeah. The choice is, if this House decides to say that we make healthcare free, then we have no problem. We will just create for you the budget. Now the amount we are spending on ECCIF, the amount this House has allocated, it's in its wisdom for PHC, is huge. So if we say that we share, but that's why we cap the chief payments on the income, that we pay more, those of us who are at the apex, so that other Kenyans can benefit. And the principal goal is to reduce those ailments which are very catastrophic health expenditure, like cancer, like dialysis. Today, Kenyans can access dialysis, particularly majority who do twice a week. They're fully paid by SHA. You can walk to Aga Khan, and Honorable Speaker, we are opening a new center called East Africa Dialysis Center soon that will operate 24 hours, where even public servants can work during the day and they do their dialysis during the night. The drivers of this dangerous health expenditure, they include surgical packages and oncology. Maybe we need to look at those ones and see as a country what we can do. Honorable Speaker, I think finally the choice of a hospital will also decide the hospital bill. There are certain hospitals, and I want to make it very clear, that they want to make money. You go to some of them, they have got, they charge you the TV, they have a private wing, they charge you their insurance. All those is lumped into the cost of healthcare. So if you go to a private wing of Nairobi Hospital, you'll pay more. But if you go to the private wing of Kenyatta National Hospital with more consultants, better. And I've seen many leaders now are going to Kenyatta Hospital and Kenyatta University Hospital, MTRH. If you go to those referral hospitals, public referral hospitals, you can get, even if you compare even the private, Aga Khan versus Nairobi West versus Nairobi, do your own analysis. So it depends on the choice of the hospital. But we have done an analysis and we have found out that surgical expenses are the drivers of healthcare costs in our country. And Honorable Kibagedi, I can assure you that we will not politicize, but we will just want to give the country the true situation. And we get a lot of feedback. In our call center run by Safaricom and Digital Health Agency, the number and the questions Kenyans ask are close to between 5,000 to 10,000 every day. Even now you can call. Total cost of the benefit package that was financed purely from the exchange, we have to say that healthcare will be free in our country, will be close to about 410 billion shillings per year. I mean, that is the reality. And the bed rebate, if you go to level 4, finally, Honorable Speaker, if you go to level 4, the bed rebate is 336. If you go to level 5, it's 392. If you go to level 6, it's 448. 50% of that is an increase from the previous NHIF. Thank you, Honorable Speaker.